I'm Nicole Brooks. I'm a fourth-year general surgery resident currently in dedicated professional development time as our surgical education research fellow. In this position, I'm involved in the curriculum for our general surgery residency program. I'll be presenting our work in development of robotic surgery cadaver simulation sessions for our general surgery residents. While robotic surgery gained popularity in other surgical specialties more quickly, there's been a more recent rise of robotics within general surgery. With this, establishing education experiences and formal curricula for robotic surgery has been a priority in the general surgery community. While literature has revealed some of the needs and current practices in these curricula, ideal learning strategies and their effects are incompletely described. In this project, we present the creation and preliminary outcomes of a robotic surgery cadaver lab curriculum that has been incorporated into our robotic curriculum for our general surgery program. The curriculum is currently targeted at our PGY3 and PGY4 residents who have gained some basic skills of robotic surgery from other forms of simulation or involvement in operations, but have reported still having limited comfort with operating in robotic cases. Each group of learners has their own lab with operations identified that allow for a variety of robotic skills at an appropriate level to be practiced during the lab. Surgery attendings with expertise in the subspecialty area serve as the facilitators for these sessions. Each session has occurred over 2 days, with the resident learners divided so that the cadaver and robot to resident ratio remains small. Along with all the many resources used by any cadaver lab, these sessions have the extra logistical challenge of needing to get an extra robot and console to the simulation lab for the activities. Coordination with our industry representatives from Intuitive, our simulation center, our faculty preceptor, and our learners have been very important for these reasons. In Figure 1, we present ratings of autonomy on a 5-point scale for a robotic operation that the resident was performing in a given day in the cadaver lab session. These ratings were obtained from the residents and the attending facilitators immediately before and after the robotic cadaver lab session. The scale for autonomy ranges from a 1, complete hands-on guidance from the attending, to a 5, completely independent practice without an attending present. The ratings consider the level of autonomy for the entire procedure with excellent technique maintained. Both the resident self-assessments and attending assessments before the procedure rated these autonomy levels around a 2, or performance with constant direction from the attending. The post-session scores for each group was approximately 2.6, more towards the level of a resident performing the operation with intermittent guidance from the attending. The pre-post scores were compared using Wilcoxon's signed rank test to compare them in a paired manner. Both the resident and attending groups demonstrate a statistically significant increase in their assessment of autonomy for a given robotic surgery operation after the session compared to before. In Table 1, we summarize some of the post-session ratings of the curricular activity from the residents and attending. These scores represent a 5-point Likert scale from 1, strongly disagree, to 5, strongly agree. 100% of residents and attending somewhat or strongly agreed that the session was valuable to education, improved resident knowledge, improved resident robotic surgery skills, was engaging, and that simulation was a valuable instructional strategy for the session. 92% of residents and 100% of attending somewhat or strongly agreed that the session had high realism using the cadavers compared to the actual robotic operation. 85% of residents and 100% of attending somewhat or strongly agreed that the cadaver simulation was superior to using synthetic simulation models or virtual simulation. 100% of residents somewhat or strongly agreed that the session was relevant to their practice and professional growth. In conclusion, we demonstrate the creation of a well-received robotic cadaver lab experience for general surgery residents. Positive effects on resident confidence in performing robotic surgery, and both self and attending ratings of autonomy and robotic operations performed were seen. Further development of these experiences and integration within our overall robotic surgery curriculum are supported to advance training for our general surgery residents. Thank you.